Veterinary dentistry is an emerging field and is becoming more and more specialized over time. Dental cleaning or dental prophylaxis is still, however, within the domain of general veterinary practice. As a veterinary assistant or technician, performing a dental cleaning will become one of your more rewarding duties. First of all, who needs a dental cleaning? Any patient with periodontal disease would benefit from a dental cleaning. Periodontal disease includes a variety of conditions such as gingivitis or inflammation of the gums, periodontitis or inflammation of the structures immediately around the tooth, and osteomyelitis or infection of the bone. The progression of the disease usually involves going from gingivitis to periodontitis to osteomyelitis. You will need to be able to help identify those patients that are showing some of the telltale signs of periodontal disease. One of the first signs is a reddening of the gums near the line where the tooth erupts. The reddening is caused by inflammation brought about by plaque-causing bacteria. Plaque is essentially a film of bacteria and mucus that lays the foundation for periodontal disease. With progression of the disease, plaque begins to build up on the tooth surface and work its way up under the gum line. As plaque builds up under the gum line, it releases substances that attack the periodontal ligament, which is a structure that helps bind the tooth to the underlying bone. Plaque also then hardens with mineralized deposits to form a calculus, which becomes adhered to the tooth. Calculi are the yellow to brown mineralized deposits that you will see on the tooth surface of dogs with more severe periodontal disease. Further progression of the disease can lead to infection of the bone. Bone infections around the tooth are evidenced by a loosening of the tooth, a much more foul odor, and sometimes even abscessation, where you see pus emanating out of pockets around the tooth. Radiographs can confirm bone infection. What are the effects of periodontal disease on the well-being of our patients? Anytime one has inflammation, it can be painful. If you see gingivitis in a patient, then at the very least the patient is experiencing some degree of discomfort. As the disease progresses, it becomes progressively more painful. On the subject of pain, many owners will believe that their pet must not be having an issue with periodontal disease because he or she is not showing signs of pain. It must be gently explained to these owners that many pets instinctually do not broadcast their pain outwardly. To do so would be to expose weakness, which may have potential ramifications to the perceived pecking order in a household, humans included. In addition, with chronic pain, pets are not complainers. They accept it as part of their lives because they do not have a choice. And sometimes, since the disease progresses slowly, and even if the pet is showing subtle signs of pain, these signs may not be noticeable to the owner. Often, many pet owners remark after a dental cleaning has been performed that their pets are much more upbeat and alert. Obviously, these pets were experiencing discomfort and pain, which their owners were understandably unable to detect. Tooth loss is another consequence of periodontal disease affecting the well-being of our pets. Incomplete dentition can lead to difficulty eating and to potential digestive problems. When bacteria are present in and around inflammatory tissues, the potential exists for bacteria to enter the bloodstream and infect the patient. Bacteria in the blood or bacteremia can lead to infection elsewhere in the body. The oral cavity is a portal of entry as well as the site of disease for microbial infections that affect general health status. Potential sites of infection for bacteria to settle while being transported by the bloodstream are the heart valves, the liver, and the kidneys. Infections in these areas can be life-threatening. To summarize, any pet with periodontal disease needs to have a dental cleaning. Dental cleanings, by helping to clear up periodontal disease, enhance the well-being of our pets by reducing pain and discomfort, prevent tooth loss, decrease the incidence of many systemic bacterial infections, and increase lifespan. Furthermore, they reduce bad breath. Now that you know about periodontal disease and the need for periodic dental cleanings, you have to communicate this effectively to pet owners, culminating in the client making an appointment for dental cleaning. Communicating this information to a client is a team effort. At check-in for routine wellness visits, the receptionist should emphasize that the pet will be examined thoroughly, including an oral or dental exam, to see whether the pet needs a dental cleaning. The veterinary assistant or technician in the exam room should examine the pet's mouth for signs of periodontal disease, and if present, show the client directly. When looking for periodontal disease, look in those areas where air cannot get to. The bacteria that produce plaque are anaerobes, meaning they do not like the presence of oxygen. These low oxygen areas include the upper outside molar surfaces and gum line, hidden by the upper lip, the base of the upper canines also hidden by the upper lip, and sometimes the upper and lower incisors for the same reasons. The tongue surfaces of the teeth tend to have less plaque formation because of the high oxygen levels present when the pet is panting. If the doctor confirms your finding of periodontal disease, then help the client by booking a dental cleaning appointment or suggesting to the receptionist to do so. If the client would like to delay doing the procedure, ask if you could have permission to call the client at a later predetermined date. Dental cleanings are vitally important to a pet's well-being, and this importance needs to be stressed to the client as strongly and tactfully as possible. Some hospitals even take a digital picture of the periodontal disease so that the client has a picture with a handout on periodontal disease to assist in convincing other family members of the importance for dental cleaning for their pet.